Out of that 60%, half of them successfully stopped. The other half, we keep engaging with them, yeah? But they have stopped smoking, meaning, which is what we were talking about earlier, meaning that the most important thing is the carbon monoxide levels, right, which is what, their fumes, basically, in a nutshell, have dropped completely to normal, healthy levels.
It doesn't mean that they never pick up a cigarette?
Unfortunately, no. That doesn't mean that, but it does mean that their health has improved considerably. Now that's the physical side, and we were discussing about the other area of smoking, which is the emotional side. Yeah, that's the one that we really need to work at, and that's also something which we offer in our clinic service. That support. Like any other addiction, our emotions are involved. We use it. Some might use it as a coping mechanisms. Some it's a habit that they've installed for years and years. They either smoke because they're bored. They either smoke because they're stressed. They either smoke. Very powerful emotions. So that's another service that we provide. That's another support system.
It's always a risk that you're going to substitute another addiction when you manage to break one.
I've noticed for some, particularly women, unfortunately, they don't want to put on weight. And that in itself is a deterrent to come to see us in clinic and stopping smoking. Why? Because we tend to replace. So the way the brain works is you've given it an addiction, right? You've given it a coping mechanism, you've given it a dependency, and now all of a sudden we've removed that dependency. What I do with those that allow me in clinic, and I must say it's most of them, is we replace habits. So I call it habit replacement. Now we replace it, and this is a good time where I give them some homework to do. I call it homework. and it's, just write a list of things that you're going to replace the unhealthy out, right? So we're going to work towards the unhealthy. We don't want to work and focus on that. And then we're going to focus on healthy ones. And this is when people should focus on the diet plans, which is one of the main ones which people, and that's why people put on weight. Exercise, hobbies,